Hello, this is Cindy Redfern, and I work at Redfern Acupuncture in San Ynez, California. I am being joined with a patient and friend, Julie Sanchez, and she's going to help me keep on track, and she'll tell you a bit of her story. I was invited by Julie to come to help out the Debbie's Dream Foundation in helping you learn about acupuncture, the Mind, Body, and Spirit series. And I am hoping to help you today with learning as much as we can about acupuncture. Okay. My forward button is not working. So I'm not Julie, I'm not being able to get it to go forward.
One moment. Click into your presentation.
Oh, there it goes.
There you go.
All righty. Sorry about that. I did say I hope I screwed this up. All right, I want to pause for just a second and be grateful and happy for where we are right now. I'm super lucky to be here. This is the first day of the rest of your life. I don't have what you have, but I have been in a place where the future looks really dismal. I'll tell you about that in a little bit, but acupuncture made me be totally comfortable and happy in my life. And I would love to introduce you to having that same opportunity for yourself. What I'm going to talk about today is my story. I will introduce you to the theories and the method of acupuncture. I'll tell you how I work with acupuncture patients to help them regain their health. And we'll wrap it all up, and then we'll have some time for questions and answers at the end. Julie Sanchez will help me moderate the questions and answers. My story is that when I was 20, I was walking in New Zealand and I got hit by a car. I got thrown 25 feet into a neighboring pasture, and I had a lot of injuries from that accident. I had 17 breaks from my hips down. I had my knees were internally severed. I had I hit my head and I had a concussion that left me in a coma. And then when I woke up, I had total amnesia. So I don't remember anything at all for about 6 weeks. And then I had surgeries to get things put back together. And I was in the hospital for 3 months. And when I came out, I had left side deficit from the hematoma in my brain. And I had some pretty severe memory issues. And I was in a wheelchair for a while, and then I was in a walker. And then, as you see me in this picture here, I had braces and I could walk, which was pretty cool. In the surgery that I had to repair my knees, they had taken out the meniscus. So that's the cushioning between the bones in your knees. So I could walk, but I started having issues with the bone on bone started causing issues. So 6 years later, I was full of bone chips in my knees. My x-rays showed 13 bone chips, and I had to move all the time to try to keep it from hurting too much. And it made a lot of noise, and it wasn't going to keep working. So the doctors were pretty amazed that I could even walk. And they said, oh my gosh, you totally need double knee replacement. And I didn't like that answer very much at all, because it just was a dismal, I had to take pills to keep from rejecting the knee replacements. And then I had to take pills to keep that from hurting my stomach. And it was only partially going to be successful. It had to be replaced every 10 years. It didn't look good. I was still in a lot of pain. I still had left side deficit, and surgery didn't sound fabulous. So my dad talked me into trying acupuncture, and I am mortally afraid of needles. It's kind of comical that this is what I do now, but I went and I watched my dad treated 5 times, thought that looks awful. And then I had one needle inserted in my hand because I was ready to, I didn't want to do it. I had one needle and it was super interesting. It wasn't painful like a hypodermic needle is painful. It was interesting. You can't describe how it feels. It's super strange. Your body never gets touched on the inside of it unless you've been injured. And so it doesn't hurt. It just feels super weird. And so after I had that one needle, I was like, okay, let's give it a go. And I had 2 treatments and I started to feel a little bit of relief. So I decided to give it a chance, and I canceled my knee surgeries, and I ended up having 24 treatments, and I got my life back. Everything was helped. My spirit was helped. My memory got better. My left side deficit left me. I had no feeling below my knees, which came back. I had looked a little bit off on one side, and that totally resolved. And I just think this medicine is totally amazing. I'm going to tell you some really fantastic stuff today that sounds hard to believe, but I am walking testimony that this works. If I was meant to do what I am doing, then my life has been perfect. Acupuncture theory, basically, I believe that we are doing the tiniest possible injury to make a profound healing response. Your body is basically like a fancy Maserati, and it's been parked in the backyard for however many years that you haven't had your body tuned up, and it's not running all that great. I am a mechanic, and I can tinker with your body until it is running smoothly, and that takes some concentrated work to get it to run smoothly. And we'll get into that later as well. But once it's running smoothly, it only needs a few treatments a year to keep it there. Just like your fancy Maserati, your body is fixable from what is bothering it 99% of the time. We're taught in school about yin yang theory. And what is that? It's actually yang, not yang, but it's okay. And yin and yang is like opposites. It's man and woman. It's hot and cold. It's energy and it's body. So yin is most like the earth, and the earth is cooling, nighttime, female, solid. It is you can touch it, you can handle it. And yang is the most like the sun, and the sun is energy. It is vital. It is heat. It is man. It is what keeps us upright and alive. And man is between the earth and the sun, and we need a balance of both to keep us working perfectly. We're taught in school about 12 different energy channels that run through our body called meridians. And each meridian is named after one of our organs. There's 12 major meridians. And if let's just take the liver meridian, it is connected to the liver organ, but the liver meridian goes all through the body. And if you have an imbalance in the liver meridian, it doesn't necessarily mean that your liver has a problem. It's just like the TV channel in your electrical system of your house. The TV is connected to one of those lines of electricity. And if you have a problem in that electrical line, it's not necessarily the TV, but it could be. So each meridian is flowing through your body. Some just do the hands, some just do the legs, some go through the whole body. And when you have problems, you can get clues to which meridian is out of balance. Oh, Lord. Julie?
Okay. So we're talking about the meridians and how it's important to have them in balance. Let's talk about maybe how acupuncture also doesn't interfere with other treatments.
Right. Thank you. So acupuncture is totally safe to use with any other modality. It only improves your body. Sometimes when you first have it, it feels like it's not improving your body. It might stir up stuff that's stuck, or your meridians get blocks in them, and then stuff above and below that block will be either excess or deficient. And so when I run my hand down a meridian and push on something, if it's got a block there, it will be painful. And so that's a good place to treat. It opens up that flow. A meridian system is a lot like the irrigation system in your lawn. It is, it lubricates everything if it's flowing properly and everything looks green and is growing fabulously. But if there's a blockage in it, then you start getting an area that doesn't work optimally and it has problems. So if you have acupuncture, it is only going to improve you. And sometimes it looks like it's going wrong, but every time it only makes your body better. And you might stir up an area that hasn't had good flow for a while, and that might have some pain involved with it, say for a couple of days after a treatment. But then it cleans up, and that stream starts flowing clearly and cleanly, and everything will heal in that area. The history of acupuncture is very debatable. China gets a lot of credit for it because they've got a written history, and there's tell that it goes back, there's a book that was written theoretically 5,000 years ago, and there's lots of debate about how true that is. One thing that is definitive and interesting is that in 1991, they found in the Austrian Alps between Austria and Italy, some hikers found a man in the ice that was thawing. And it turns out that he was 5,000 years old, and he was the most intact mummy ever found, and his implements and his tools and his food were with him, and it was all recognizable, and a bunch of study was done on it. There's a program about it called The Iceman in the Discovery Channel, and what was really interesting about him is they did a whole bunch of study, and they found that he had, in the end, they found it was 62 points tattooed on him that were acupuncture points. They corresponded to his internal injuries from many injuries that he'd had in his life, and they were a primitive form of acupuncture. And so the question is, was acupuncture further spread than China? And China got credit because they had a written history, or did he travel to China, and how would he have traveled to China 5,000 years ago? But it did definitively show that acupuncture has been around for at least 5,000 years. I find that one super interesting. Discovery Channel, The Iceman. So what can you expect when you go into an acupuncture treatment? One of the things we do early on, we don't always do it because sometimes we know what we're treating and we know what's happening with you, but we check your pulses, and that tells us what is happening in your meridians. So on your right hand, the right wrist, the radial artery, which is on the thumb side of the wrist, you feel the pulse in 3 spots. the first finger I use is my ring finger, and it goes just at the wrist crease, and then you have to kind of bend your middle finger so that it fits on the same line, the radial artery, and then your index finger goes at the third position. And those on the right side, that tells you your lungs, which also has to do with your immune system. The middle position is your digestion, and the third position is the energy of your body. How are you feeling energetically today? Then on the left side, you do the same thing. Your ring finger goes at the crease, and you're feeling the heart. And the middle finger, you feel the liver channel. And the index finger, you're feeling the kidney itself. And we can see if some channels are they in balance compared to each other. Usually it's sort of a stepping sensation where the first position is stronger, the middle position is a little bit lower or deeper, and the third position is the quietest, like a stair stepping. But you can also feel if one is excess or one is deficient. You can tell if there's heat in one or too much cool in another, and you can work on getting those balanced, and that shows what meridians in your body are working properly and what aren't. Another thing we look at very often is your tongue. So your tongue is meant to be pink and even colored and fit your mouth, and about the color of your lips. And then just at the very back, there should be a light coating of white on it. And that is the back of your tongue indicates your kidney, and your kidney needs to have moisture in it. So you want a light coat at the back. And then it should be fairly uniform pink. And that being said, there's a whole bunch of different tongues out there. So things we often see is with a red tip, the tip of your tongue shows your heart. So if the tip is red, that shows heat in your heart, and that can come across as, or be felt as, anxiety. That your heart, when it's good, has joy. When you're anxious, it has anxiety. And if it's tired out, I would feel that in your pulse, then you would have a feeling of apathy, like there's no hope, this is just hopeless. That's your tongue. The sides of your tongue indicate your liver. So if they're red, then you've got some pent up, some heat in your liver, which can show up as frustration or anger. And you just, let's see, what else we have? We have, if you have
let's talk chi. Let's talk about chi.
We're gonna get there. If you have a white coat on your tongue, then if that is phlegm in your system, and that's not a great thing to have. And just a little aside, if oregano spirits drinking oregano spirits mixed in water can help get rid of phlegm. You shouldn't have to brush your tongue in the morning to get rid of a white coat. That is makes your system go sticky and hard to move. And if your tongue is purple, that's a stagnation. That means your meridians are not moving properly and you need to get things going. So as Julie was bringing up, do you have chi? That is like the key to whether everything is working or not. So when I'm going to put a needle in you, I have a little tube and I put it against your skin and I do a little tapping, and then I tap the needle in. You usually don't feel very much with that. And I put the needle in place and I take my hands away. And that is when I'm really hoping that your body kind of goes, what the heck is that? And so if you feel a prick while the needle's going in, it's your body's kind of going, yikes, it's your nerves, it's your nervous system. It's not helpful. If you feel a weird tingling, tightening, strange sensation, that is your body looking at the needle and going, what the heck is this? And I think of it like a bunch of Pac-Man go rushing in there and look at what the needle is pointing at. So I try to put the needle right where I want your body to look, and the body rushes in and goes, oh my gosh, what's here? And starts cleaning it up. That is the plan. There's 17 words for chi. Prick is not one of them. So it is super important that the acupuncturist is using the size of needle that is comfortable, but still causes your body to look at what we're pointing at and go, oh my gosh, what's happening in this spot, and start cleaning it up. If your immune system is shut down, you won't feel the chi. You might not even feel the needle at all. And so I believe it's very important for your acupuncturist to work on making sure that you're getting chi. That is the healing, what will cause your body to heal. So what do I do to treat cancer patients or patients that have cancer? These are pictures of Julie Sanchez. You're going to meet her in a little bit. And she has been through all of the stuff that many of you are going through. Cancer is always present in the body. It is there, your body, it's one of your cells that has gotten imperfect by something that has happened to it. Too much sun, too much alcohol, too much smoke, too much whatever has damaged your cells, and they are not performing correctly. And your body, when it's working properly and all your meridians are open and it gets to everywhere in your body, it will see that there's cancer there and it cleans it up. If an area is stagnant because the meridian is not flowing to that area, then an area can just get stuck and nothing's happening there. The stream is not flowing through that area, and cancer can get to start growing. Cancer loses what's called its differentiation, and so it stops growing. It stop growing. Like, it keeps growing no matter what. And usually your cells will stop growing. That's called differentiation. But cancer is when your cells don't stop growing. So if cancer gets big enough, it puts off an enzyme called nagalase that shuts down your immune system. And so it can get growing bigger and bigger. And what I believe nagalase is what I feel when I put a needle in and you don't feel it. So almost every year, I can't even remember a person that I've treated that had cancer that had chi. Almost always they don't have chi. And so the biggest thing for the first 3 to 5 treatments is trying to get past the pricks and get your body to feel the body's energy working. It's pretty exciting when it happens. It's weird, and you'll feel it. And we start getting like little hints of it, and then it starts coming in, and it's pretty exciting when it happens. And then you know you're going to improve your situation. I totally believe that you need 2 to 3 treatments a week. I do 2 treatments a week. Acupuncture works for about 3 days, and then on the 4th day you start losing a little momentum, and after about 4 days you're starting to slide back. So I find that if you go every 3 to 4 days, you keep moving forward without losing any ground. So if you have a treatment, you go 2 steps forward. After 3 or 4 days, you start sliding back, and if a week has passed, you'll have 1 step forward, and you'll stay there. You won't totally be a waste. But if you have another treatment within 3 to 4 days of the first treatment, then you move another 2 steps forward without losing any ground. So you're actually 4 times better at the end of a week with having 2 treatments than the 1 step forward that you would be if you only had 1 treatment. With cancer patients, I really don't like leaving it more than that 4-day lapse, because cancer is aggressively trying to win this battle you're having, and you want to stay ahead of the game. So try to get your treatments no more than 4 days apart. This is not a quick fix. This isn't a Band-Aid. This is fixing your body, and many things will fix that you didn't even tell your acupuncturist about. The shortest I have had to arrest and get your body working well again when you're having significant problems is 2 months of twice a week treatments. If somebody's pretty far gone and they're well down the rabbit hole, then it can take up to like 1.5 years to get them back, 2 treatments a week. And you can, you can go on a little vacation once in a while. It's not gonna totally disrupt anything, but you want to keep at it until it's gone. And I am super blessed in that I'm very busy. I have a 3-room clinic at the side of my house, and I'm busy. So I would be super excited for you to go find yourself an acupuncturist. I would interview a few on the phone, say 6, and see if they're willing to treat your condition, and see if they get chi, and if they're willing to try to get chi or learn. And I would go to 3 different acupuncturists and see which one you like best. Julie Sanchez has an amazing story, and she has brought me here today, so I'm super grateful for that. And I am going to let her tell her story in her own words.
Thank you, Cindy. So I'm Julie Sanchez. I am a cancer patient. I am a cancer survivor. I was diagnosed with stage 4 stomach cancer in June of 2021 with minimal to no symptoms. I mean, really, it was, to say it was a shocker is an understatement. And those of us who have stomach cancer, we know that this is the silent and deadly cancer that often goes undiagnosed until it becomes stage 4. And we all know there is no stage 5. So I was very fortunate in that my sister is a nurse and very into, she's classically, traditionally trained at Vanderbilt, but she's also very into complementary medicine and other types of healing modalities. And she had met Cindy at one point in time. They crossed paths at a clinic. And so before my formal diagnosis, but after I had been to the ER and had, a bad CT scan and was now going through all of these tests, and it did not look good. As many of you can relate, I was just a basket case. I was a complete basket case. The uncertainty, the unknown, and then you suddenly become a member of a club that nobody wants to join. And then you need to learn all of the rules right now. And you need to figure out what you're going to do right now and what doctors you're going to see right now. And how many opinions are you going to get right now? Everything is right now. And it's overwhelming. And so during the 2 to 3 weeks between what I refer to as kickoff day, which is when I went to the ER and had a CT scan, and D-Day, which was my actual diagnosis day, I got referred to Cindy by my sister. And I went, she said, you got to go see her. She's the real deal. So I went to see her. And the first session, I remember it so clearly. The first session that we had, I had no idea what to expect, but my mind was, again, basket case. The first session, I cried probably through the whole session, because as the needles went in, as Cindy said, they don't hurt when they go in. And people always ask me, does it hurt? It doesn't hurt when it goes in, but when that needle activates the meridian that we're trying to reach, then you feel either, for me, it's like an electric feel, like a buzz. It could be like a bee sting, or when we really hit the sweet spot, it's going to be honest, it's a little like a cattle prod. It usually only lasts for a couple of seconds. But what that did that first session was such a release of all of this pent up, for me, like garbage and energy. And I discovered my mantra in that moment, because you have to lie under the needles for about a half an hour after they're put in. So I always used that time for my meditations. And I'm not a big meditator, by the way, but I became a meditator during treatment. And I went to see Cindy religiously twice a week, Mondays and Fridays, every single week, all through my treatment, my conventional treatment, which I was not a candidate for surgery. I was a candidate for immunotherapy. I'm PD-L1 positive. I'm HER2 negative. I'm CDH1 negative. For those of you who don't know what that is, that's the stomach cancer causing gene. And if I had been CDH1 positive, the treatment would have been total gastrectomy, remove my stomach. But in my situation, what I had was a mass in my stomach that was the emitting offender, and then it had spread to distant lymph nodes. So no other organ involvement, but that's what made it stage 4. So I did 12 rounds of FOLFOX chemotherapy. So that's it's a 3 chemical regimen of folic acid, oxaliplatin, which is a platinum-based drug that gives you neuropathy. So that's another story. And also the very popularly named 5-FU, and would go home for 48 hours with that pump on my chest with the 5-FU in it. So I did that for 12 rounds. 11 of those rounds also included Opdivo immunotherapy, checkpoint inhibitor, basically. And I was really fortunate, but the acupuncture helped me with nausea control. I feel a real victory because I made it through my entire chemotherapy without throwing up once. So woohoo. It helped me with clarity of mind in the beginning to make the decisions that I needed to make on what treatment path I was going to go with, what doctor I was going to go with. Life or death decisions, essentially. When you're a stage 4 cancer patient, those are life and death decisions that you have to make very quickly. So giving me peace of mind, giving me an immunity boost. I will say throughout my entire chemotherapy journey, which lasted 6 months, most people who would look at me would never know that I was going through chemotherapy. Most people who would look at me would say, wow, you look really good. Like, yeah, I'm like the chemo poster child. I myself personally give a lot of gratitude to Cindy and to acupuncture for helping me through that phase. And in January of 2022, I was pronounced in an excellent remission. So in 6.5 months of treatment, including twice a week acupuncture, I went from stage 4, treatable, not curable, it's terminal, to a full remission. And I don't know what explanation that we can give to that, except in my heart, I know that acupuncture played a big part. I continue now on immunotherapy only every 2 weeks. And I continue to see Cindy, but I see her now about once every 2 weeks. And, you know, I will be honest, and this is something Cindy and I have talked about, if you're looking for something that's nice and comfy and it's going to make you feel good, like, you know, like a massage, go get a massage. If you're looking to get better and address the roots of what's going on in your system, and this is not just for cancer, but really it can be for anything that is amiss in your system that you are sincere about changing, whether it's pain control, whether it's just clarity of mind, whether it's any other kind of disease, then a really good acupuncturist can certainly be part of your overall treatment plan. And for me, I recommend Cindy to everybody. And people that I have sent to her have said, this is extraordinary. I didn't know what to expect. Actually, one person, after the first time she went, she said, she called me and said, is it normal to feel like you've been hit by a truck? I said, sometimes, yes, because if you are so blocked, like I was at the beginning, I would have a treatment session. First of all, I wouldn't drive myself. I'd have my husband drive me, and he would drive me home, and I would go to sleep for 3 hours because my body was just trying so hard to heal. And I would say when you're looking for an acupuncturist, just as when you look for a physician, for a doctor, there are doctors who practice medicine, and then there are doctors who are healers. There are acupuncturists who can do acupuncture, and then there are acupuncturists like Cindy who are healers, who just have this gift, and it's almost like you'll know them when you talk to them. You will know that this person should be part of your team. I continue with acupuncture for myself because it worked. It worked in conjunction with my traditional medical interventions. It worked. There's no other explanation for why I went from stage 4 to excellent remission, as one of my oncologists says, why I had such an excellent response to treatment. I give a lot of credit to acupuncture, and that's my story. And I'm just so happy that I'm here to tell it. Thank you, Cindy, for having me.
Thank you, Julie. You have an amazing story, and I'm super happy for you. So in conclusion, I want you to know that it is possible for your body to work again, to work the way it's meant to help you. And I do not know any better way than with getting acupuncture to optimize your body to heal itself. Your body is pretty darn amazing. I call it our Maserati. I don't need a lot more business. I'm super happy to help you as much as I can, but my goal is to help other acupuncturists learn how, at least how I do it. We are not taught how to do this in school. We are taught to shy away from it. I believe that people that have big problems are the ones that need acupuncture the most. And I don't understand why we're told to stay away from it. I went to school 12 years after my accident, and they were telling us we couldn't do stuff that I know positively you can do because it was done on me. So I totally encourage you to give acupuncture a try. I am happy to have discussions with other acupuncturists about the techniques that I use. If your acupuncturist is willing to or wanting to learn as much as possible or learn how someone else is doing it, I would totally appreciate if you could contact Debbie's Dream Foundation to coordinate that, so that I can meet with 2 or 3 at a time instead of 1 at a time, but I'm happy to help as much as I can. So now I'm going to open it up to questions. I'm sure I haven't covered everything. This is the first time I've done a Zoom call, and Julie's going to help me with asking any questions that come up.
Well, we have some great questions. So
okay.
let's try to bop through these really quickly. So Melanie asks, if acupuncture is good for the treatment of neuropathy, because many of us, myself included,
Yep.
experience neuropathy as a result of some of the drugs that we take for treatment.
And that is a great question. I had no feeling from my knees down when I started with acupuncture, and it was 6 years after my accident. So it definitely was not going to be coming back on its own. My acupuncturist, bless his heart, was one who went for getting chi. And so in my legs, he would work with the acupuncture needles for quite a long time until I felt something. And I found that like totally amazing that I could feel something below my knees. It actually made me faint the first couple of times, just so you know, that's possible. But it wasn't out of pain. It was kind of like a shock that my body was able to do stuff I thought it couldn't do. Anyway, Oh, where was it going?
I would say for me, the answer is yes. It helped with my neuropathy. I almost kicked you in the face the first time you did my foot. So
yes, the neuropathy question. Yes, it is totally, your peripheral nerves can regrow. If you're severed completely at the spinal column, you can't help it. But if there's a tiny flicker anywhere, I work on paralyzed people. If they can get a tiny flicker of sensation or movement, there's still a connection, and that can be totally strengthened, and it can totally regrow. It is slow for the nerves to regrow, but it is completely and absolutely possible.
okay, so our next question is, and I personally know the answer to this, can acupuncture help with nausea and vomiting?
Yes, it can. We can help make your stomach channel very open. I use some buttons that have it's sort of like a Band-Aid with a tiny tack attached to it. It's very small that you can put on your wrist that helps with nausea. It's a pretty famous point for nausea. There's those C-bands that also press between the two tendons on your wrist, and that can help a lot with nausea or the flu or any nausea problems. But yes, it definitely can help make your body accept the treatment much better.
Okay, and so along those lines, because we talked about the stomach meridian, how does releasing the chi and meridian flows get impacted by the loss of the stomach as a major organ? Because many stomach cancer patients have either a partial or a total gastrectomy, which is the removal of the stomach.
Right. So one thing I really like to do with stomach patients and people who've had compromises to their stomach system is I love to do, it's called a hara massage, but it's massaging the stomach, and I do it with a capsicum menthol cream that is both hot and cool, and I use a THC product, or I guess it's, sorry, a CBD product, and it helps. It's good for lubrication, and it helps. I'm not exactly sure why, but I do a massage on the stomach, and that helps sort out what you've got. And I'll maybe do that for 10 minutes at the start of a treatment if you have stomach things going on. I start more lightly to what you can tolerate, and I get deeper and deeper, and that does wonders to sort out your stomach. Acupuncture, then I will treat you just as if you were a normal person. Our bodies are very adaptable. It is amazing how we can get along without a spleen and without a gallbladder and without parts of our body, and our body just sorts it out. So you will have a tendency to have blockages in your stomach, but that massage will open it up, and the needles also will help make the connections between where there's gaps, and your body will behave as optimally as it possibly can when you get the energy systems working. If you're missing parts, it still can work pretty darn well.
Okay. Question is, will I experience any pain following an acupuncture treatment?
Sometimes if I have opened up areas that are stuck and not moving, it just like a pond that's gone stagnant in a place. When I stir that spot up, the stagnation kind of moves out into your body more, and that helps your body clear it, but it might not feel fabulous at the time. You might have a flu-like feeling. You might have an ache around where there was stagnation and I've opened it up. You might have a malaise. You might just feel kind of wiped out. And those are good things. Like if you have a treatment and feel absolutely nothing afterwards, nothing at all, good, bad, or ugly, then I don't think we did a good enough job. I want you to mildly and tolerably feel a change. And sometimes that change doesn't feel fabulous at first, but it is getting things moving. It is getting things going. The whole problem with disease is stuff is stuck. It's not moving. So flowing chi is the key to making you be healthy as you can be.
I will say personally, I've had experiences where I say I had to bow out of the needles instead of going the full half hour, just because the release of the sludge within me, if you will, was making me not feel really great at the time. But I used to say to Cindy, I'm the reverse of the country music song. I might not like you right now, but I'm going to love you in the morning, because I know that would pass, and that it was worth it. And conversely, sometimes I had treatments where after the treatment, I would feel buzzed. I would feel so bright, and so everything was four-dimensional. But almost have to sit for about 5 or 10 minutes before I got my car to drive home. So it can go both ways. Personally, I've experienced it both ways. Next question is, are there any side effects associated with acupuncture?
There's no bad side effects. One thing I totally love is I can't really do anything wrong. The only caution an acupuncturist has is not to puncture the lungs, because the lungs are inflated like a balloon, and they will slowly deflate if you manage to get a needle into them. But we're trained very precisely on not doing that. Every other organ, I mean, I don't go into the eyeball, but I treat in the eye socket. I treat every place in your body depending on what's wrong. I have to fix everything that goes wrong. So there's points that are difficult. None of them are extremely painful long-term. Sometimes, like the bottom of your feet are sensitive when they're treated. And I try to mitigate that. And I'm totally forgetting the question at this point.
Nope, that's okay. I think you answered that question of the side effects.
Okay. There isn't any bad side effects. You might be tired. You might feel fabulous. And most of the time you feel just a teeny bit different. Like once you've gotten into the swing of things, it's not horrendous. Right at the start, you're going to have more changes. But once you're in the routine of treatment, most people look forward to it. It's a lot like going to the gym.
Okay, and then next question regarding qi. Is qi something that every acupuncturist is familiar with?
We're taught to get qi. I believe it is crucial. I don't like needles. I still am kind of wimpy when I get needled, because you never know what the needle's going to feel like. And there's just this like, wow. And I think that's actually good for your body, because we are trying to replicate your body to have a profound healing response by alarming it, like putting you on alarm. So I don't think it's a bad thing that you're nervous about it, but oh Lord, I'm sorry, I'm forgetting the question again.
That's okay. Are all acupuncturists familiar with qi, with achieving qi?
So I had an acupuncturist that helped me for a long time, and he was great. I had the 3 months of acupuncture, and then I had a few follow-ups to keep it going in the right direction. And then he moved away. And so I went around trying to find another acupuncturist. And I found these guys that would do great acupuncture, and you didn't feel it. And it was so charming, and you'd lay there and it just felt wonderful. But I didn't find that it helped my pain go away. So that was where I learned that it doesn't have to hurt, but you have to feel at least a half of 1 on a scale of 1 to 10. You have to know the needles are there. It doesn't have to hurt. You just have to feel something as you're sitting there, and they might chatter the needles will sort of talk to each other, where one will get excited and your body kind of tightens up on it a bit. And it's like, whoa, and then it'll move over to another one and it'll start chattering away. Anyway, acupuncture is amazing and wild. Everybody has qi. Accessing it is the hard part.
Okay. So another question again, because many stomach cancer patients, or cancer patients in general, but stomach cancer patients have some form of surgery, whether it's a tumor removal, partial gastrectomy, total gastrectomy. So how soon after a surgery would you recommend that someone begin acupuncture?
My favorite answer to that question is get acupuncture first, because when you have someone going in with a knife and disturbing a tumor, it has a tendency to spread seeds, like to metastasize. And if you get acupuncture before you have surgery, you can prevent the metastases because your body is working optimally and will clean up any metastases that happen in your body. If you feel chi on a treatment, your body is working and you can go have surgery and you'll be fine. If you've already had surgery, wherever you are is a good time to start getting acupuncture. Acupuncture is only going to optimize your body to work as good as it possibly can. So immediately after, I've had people come to me on the day after surgery and, maybe you're too tired or whatever. As soon as possible, I would do it before you have surgery. If you can, I would do it as soon as you can. If you just start today.
Okay. I would say for me, I did not have surgery, but I tried to schedule my acupuncture appointments where I would have acupuncture the day before my infusion and then the day after I had my pump removed. Towards the end, I had to change my infusion day. So for a long story, but I would have acupuncture the afternoon after I had my pump taken off. And Cindy can attest, that was usually my worst day. That was in my cycle of treatment. That was always my worst day. I mean, there were a couple of times where, as I said, my husband drove me and I would drag myself in there like a dog who'd been thrown in the mud. It's sometimes hard to go to acupuncture when all you really want to do is stay home and be in bed and heal. But this is part of the healing process for me. And so it was important for me to just be on a schedule. It was just a schedule of my overall treatment. Like every 2 weeks I'd have infusions, every Monday and Friday I'd have acupuncture. And I really didn't have anything else to do. So I focused on the healing. And so I would concur with, for me, I started acupuncture before I started treatment. And I believe for me, that made a difference of how I entered into the traditional medical treatment of basically being poisoned. So let's be real. That's what chemotherapy is. So the acupuncture helped me deal with the poison and helped my immune system, along with the immunotherapy, to be as active as possible. It's never, for me as a patient, it's never a bad time to have acupuncture. That's what I would say. Do we have any other questions? I think we're coming to the end of our time here, and this has been wonderful. There have been great questions, so thank you everybody for weighing in. That's been awesome.
Thank you. So I want to give special thanks to the Debbie's Dream Foundation with the Mind, Body, Spirit series. I am super, super lucky to have been asked. Thank you. And there's some great sponsors that help make alternative treatments for helping cancer patients a reality. And bless you all. I hope you have a fabulous day, and I wish you the best of health. Did that work?